This presentation, I think, is from my bottom of my heart. From getting from the submolecular and from a very cellular, subcellular, I have tried to analyze what is the actual current situation in sickle cell disease in Chhattisgarh, which is probably more relevant, and the intervention probably is very important. And for this, in 2 years, the cases that attended OPD were selected. The nutritional status, hematological parameters were studied, and the nature of hemoglobinopathy was confirmed by HPLC, BioRad HB variant, and data analysis was done by Microsoft Excel 2007. What is important was, out of 2,300 and more cases that came in this period, 1,670 records were found complete. There is a huge database which was collected by Dr. Patra, and we tried to analyze. And what was observed, that of these 1,670 cases, 1,507 were sickle cell SS and 163 were sickle cell beta thalassemia cases. Let us start from what was the situation of these children. Now, of these 1,507 cases, most of them, about 60%, were children. And between 15 and 18 years, there are another 145 cases, and above 18 years, there are 453 cases of sickle cell homozygous cases. This is the sample which was studied. Now, these are the community-wise distribution: the Teli, Kurmi, Gada, Rawat, Satnami, Panka, Agaria. These are all tribes, scheduled caste. Some Kurmi and Kunbi are probably related from we get Vidarbha. There are some OBC Rawat, and tribals are also included in Gond and Agaria. Now, this is a more or less distribution of sickle cell what we see in this region. Now, this slide, I think, is a slide which is most depressing of whole slides. If you see this number, up to 10 years cases, there are 519 children. And it is surprisingly and depressing that only 63 out of these were having normal health, as from the 2015 growth standard of Indian Academy of Pediatrics, which are more or less similar to the WHO standards. And a huge number, 1/4 and little more than 1/4, are severely malnourished, that is below 2 standard deviation, and below 3 standard deviation is another 125 children, indicating that the sample which was coming to this center in Raipur, the undernutrition, malnutrition is a very major factor. And this slide, I think, is another heartbreaking slide. If we see the above 18 years were calculated for body mass indexed, and below 17 is supposed to be a very severe malnourished condition, and 18.5 and below, they are supposed to have high risk individuals with low BMI. And what does this shows, that out of this, a huge number were having low BMI, and of this 16 were already married and 23 were married. In this means, of this about 95 ladies another half of them were already married, and this means these ladies are undernourished, and I don't know what will be the situation of next generation. They will have a low birth weight IUGR babies to born. As compared to that, the incidence of low BMI was more in males. This is very surprising, and about 1/3 of the male were having below 18.5 BMI. That emerged. These two standards were used, which are quite reproducible, indicating that of these adults, only 54 males and 48 females were having BMI above 20. That means they were healthy. And this is what is the worrying situation. And unless we are worrying for this, I think the purpose of this huge intellectuals will also be questioned, to at least in India. Now, this is the relationship of hemoglobin status, and only out of the 1500 odd cases, 124 were having a good hemoglobin level, and most of them were having hemoglobin between 6 and 12 grams, but surprisingly 105 patients were having less than 6 grams of hemoglobin, indicating that this is another second big constraint these children who came to this unit were having. And this is the slide which we analyzed what was the MCV of these cases, and one can see that 75 is a cutoff point. MCV below 75 indicates a microcytic RBC, and it is very depressing to know that again a huge number was having microcytic RBCs in the tune of 28, 24 and 20%, and those who are having 12 grams of hemoglobin, only 13% were there, but they also had a microcytic RBC picture. This is relationship of hemoglobin F. I was discussing with Madam yesterday that, see this slide, last slide, we have above 20% fetal hemoglobin in about 679 out of these 1500 cases. And even the age of younger age group, they were having same pattern more or less as hemoglobin F level. All the age groups, the HbF level in the sickle cell disease children was higher in this population. The relationship between hemoglobin F and routine hemoglobin was analyzed, and what was observed that more or less even with a very high HbF above 20%, the mean hemoglobin was 9.2 grams, and those having little low, about 15 and 10 were also having 8.02 and 8.6 grams of hemoglobin, and those with low HbF also, the mean hemoglobin level was 8. And what was important that these were showing some relationship, but this was not this scatter is very wide, but the statisticians told me that the relationship is significant, that a very high HbF level were also associated with high hemoglobin level. We tried to analyze hemoglobin F level in this sickle cell, and what was observed was again reflecting the nutritional status of this population. And for this, the children up to 10 years were taken, because After that, the pubertal growth, the confusions were little difficult to interpret, but we can see that of these 519 cases, only 63 were healthy. And most of them, again, more than 1/3 and 1/4 were having nutritional status below 2 standard deviation and below 3 standard deviation of IAP growth chart. Now this indicates that probably HbF is not playing a very major role in improving the situation. This is again the hemoglobin status. We had 56 children which were having hemoglobin less than 6 gram and only 8 were healthy. Now, what was the importance of this study? The 2016 Government of India recommendation has shown that the nutritional status of tribal population and our SC population is at the lowest level of our nation. And these communities are also having high incidence of sickle cell disease in Chhattisgarh especially. Now, severe malnutrition is common in children in Chhattisgarh, probably to some extent in western Odisha, part of Jharkhand, maybe part of Maharashtra, that is Barar, old Barar. Now, adult BMI of 18.5 and low, which again is more than 50% girls, I think again a high risk mother and high risk girls, they are likely to give to a low birth weight babies, indicating that these are again a high risk problem. The adults with low BMI is again a huge problem for our country. These individuals, they have poor physical activity, and it has been calculated that this is the cost of 5% in fall of our national GDP. It indicates the productivity of our nation to up to 5% is responsible for low working capacity, which is partly because of nutritional origin and partly because of anemia. And combination of both, we don't know what is the percentage involvement of each segment. And there is a IQ loss because of malnutrition and anemia to the tune of 10 score. In other words, the high degree of anemia, which includes iron deficiency and other nutritional factors, they add to the severity of problem of this sickle cell population in this region. And most cases were having high HbF level, which was not contributing to better health of this patient as expected. Even with high HbF level, lot of patients had low hemoglobin and poor nutrition, and studies are required to investigate the HbF level in sickle cell regions, patients of this region, especially to see what best we can take benefit of this HbF level, which is supposed to be protected. Probably if we forget HbF level for some time and only concentrate on nutrition improvement and improvement of micronutrient deficiency, our sicklers will be protected by their HbF level, which are reasonably high. But this, of course, will have to be confirmed. And if we have to fight sickle cell disease in our country, interventions to improve nutritional status should include proper diet, micronutrient supplementation, and this should be given highest priority in sickle cell disease population of this region. If this is done, probably most of the job is done by itself. And this is not a easy way of intervening, because if we give the food to the Anganwadi workers, part of it she uses because her family is also hungry, she is also hungry. So whatever the nutritional supplement programs we are having, they are not getting benefit to the last segment where they are meant for. And if we can take a study so that we first concentrate on improving nutrition and anemia, probably that should be given a higher priority to this problem of Odisha, Chhattisgarh, Jharkhand, maybe Maharashtra, than other priorities which are also equally important. And the recent studies done in the Ravi Shankar University in association with us, they investigated with newer technology, the RNA based, the genetic polymorphism in tribes is very high. Even from 50 miles from one place, the next tribe has a different genetic makeup. There may not be sickling, there may be some other deficiency, they may have other genetic differences. Thereby, we will have to take every tribe as a separate entity if we want to improve their health in details. Thank you.